So this is our presentation over recommendations towards radical belonging. And before we get into our specific recommendations for this proposal, I first wanted to touch on our team definition of radical belonging in healthcare. So as a team, we came up with the definition of feeling like a valued member of a healthcare team from all angles of the interprofessional experience. And really, that breaks down into some radical belonging components that we thought were very important, which were being able to express your opinions on the interprofessional team, feeling like your views are valued, and then also feeling like a member of the team along with thinking the same of others. In other words, feeling like you and all of the other members on the healthcare team have a vital role to play that adds value and enriches the interprofessional experience overall. And so really the important reason why we're bringing radical belonging up right now is because COVID-19 has disproportionately affected Black, Indigenous, and people of color. It has unjustly affected them in more ways than white populations, increased morbidity and mortality, and overall it has added stressors on these individuals, which has also negatively affected interprofessional healthcare teams because these individuals are dealing with more COVID-19 related stressors. This all carries over and affects them in every aspect of their life and can affect them in the workplace as well. And so really it's important that we address belonging in our healthcare teams at the root of the problem to overall increase satisfaction, productivity, outcomes, equity, and equality.
I'm going to discuss why belonging in healthcare teams is important based on the research and literature reviews that Holly just summarized. By creating a culture of belonging on healthcare teams, this allows for each individual to feel like their voice is being heard, as well as to feel comfortable sharing and advocating for the patient. It allows members to be vulnerable with each other, ask questions and clarification when needed, and allow team members to connect on a greater level simply than just being coworkers. An important way to build belonging is to talk with your team and understand each individual's role and scope of practice, as well as what they bring to the team in order to most effectively meet the needs of the patient. Additionally, if the team fails to communicate effectively due to lack of belonging, the patients may not receive the care and services they need. By establishing this culture, it allows each team member to feel valued on the team and can lead to better collaboration, communication, and quality of care for each patient the team serves.
When it comes to our recommendations for supporting radical belonging within this organization, it's important to first identify what is important. So we want to take into account the mission of the organization, the values of the people that make it up, and also the needs and values of the community that it serves. On an organizational level, mHealth can reevaluate their mission statement and their core values to ensure it reflects radical belongingness appropriately. It would be ideal to bring together various focus groups among the different tiers of the organization to determine what are their shared goals and values throughout the company. On a team level, each team should be evaluating within their own community in which they operate. It's important to determine the needs and inequities among their own individual regions, as well as providing space for self-reflection on the team's realistic capacity of what they can actually provide to the community. The team will then decide what updates and changes are within their ability to fulfill with excellency. From there, we recommend that it may be helpful to have a liaison or a team that is sole purpose is for communication between the community and the organization. So all open lines of communication don't get lost in translation. From there, with the individual level, we should reflect upon one's own career goals and values and how important it is that one is employed by an organization that aligns appropriately with these goals and values. In addition to radical belonging on a team level and an individual level, an organization should empower their employees or their members or their community to, advocate for change when there is any disparities among the community. It's a responsibility of management teams and the mission of the organization to welcome discussion by having strategies guided by legislation or policy in place in order to address topics as they arise in an organized manner.
Hi, I'm Nishani, a SLU PA student. To begin, I wanted to go ahead and introduce a few individuals from marginalized communities and explain how COVID-19 directly impacted them. Kadra, a family medicine physician, Sarah, a registered nurse, Jesse, a nursing home aide, Jonas, working with environmental services, and Andrea, working within healthcare administration, all noticed COVID-19 taking a toll on their work life, from impacting overall character and decreased attendance at work, to tending to an understaffed healthcare system, to dealing with a sense of lack of belonging, as well as feelings of isolation, to simply attending work to make ends meet, as well as feelings of decreased motivation. These individuals have seen it all. From the countless of negative effects COVID-19 has had on marginalized communities, my team and I decided to hone in on the toll it has had on mental health. According to Kaiser Family Foundation, overall 64% of households that house healthcare workers have noticed struggles with mental health. Within St. Louis specifically, according to the STL American, around 25% of individuals older than 65 have noticed feelings of isolation, which in turn is leading to an increase in dementia, a risk of dementia, depression, anxiety, and suicide. Within marginalized communities specifically, there has been an increased risk of morbidity and mortality, leading to feelings of stress, isolation, exhaustion, and countless resignations. As a team, we hope our proposed interventions will be able to bring about necessary changes. Initially, introducing monthly interdisciplinary meetings will allow an opportunity for these individuals to voice their opinions regarding need for change, as well as bringing about ideas to start that change. Also, this allows for these individuals to work together to develop their critical consciousness, strengthening the democratic belonging, allowing these individuals to question their own beliefs and work together to bring about change in that sense as well. Our second intervention would be to provide mental health services, complementary therapy sessions to all team members of the healthcare team, with importance placed specifically on individuals of marginalized communities, ensuring that they do have this access. This will allow for assistance in dealing with these stressors and feelings of isolation in a healthy way.
In terms of implementation of our intervention, we would like to start off by first creating and collecting a pre-implementation survey. The purpose of this standardized survey would be to assess the well-being, job satisfaction, and impact of COVID-19 on our health professionals. We would like to collect data from professionals across several healthcare departments in order to have a complete understanding of the effects and current status of all our employees. Next, we'd like to have an introductional meeting regarding the intervention. This meeting would ideally be a recorded meeting that would be shared with all the employees. Included in this meeting would be an explanation of the problem at hand, We would discuss the negative effects of COVID-19 on our healthcare systems while correlating these concerns with the data that we have collected from our pre-implementation survey. Next, we'd create a detailed plan and lay out this plan to the employees within this meeting. The plan would include monthly interdisciplinary group meetings. Groups will be randomly assigned, and each meeting will have a specific topic and outline. Prior to each meeting, a team member will be assigned as a discussion leader, and the focus of these meetings would ideally be to discuss personal viewpoints on topics like organizational values, team expectations, and personal growth, some of the things we touched on in the previous slides. In terms of a long-term plan for the layout of this intervention, we'd ideally want to create a post-implementation survey as well and recollect data from the same employees at about the 3 months time mark since the intervention was introduced. Additionally, we would like to develop a leadership committee with volunteer representatives across all healthcare departments. The committee will meet to review the survey data and discuss the progress of the intervention thus far. Based on discussions held at this meeting, adjustments can be made to optimize or further expand this intervention. In terms of accountability, we believe that the development of interdisciplinary teams and leadership committees will allow for each healthcare team to have proper representation. By granting individuals an avenue to express their views amongst other members of the healthcare profession, we hope to promote accountability and transparency.
Hi, my name is Ron, and for this part of the project, I'll be discussing the implementation of metrics to determine the efficacy and success of our proposed interventions. For our group, we determined that longitudinal data gathered through qualitative surveys would be the best way to go about this. Prior to the implementation of our proposed interventions, as previously discussed in this presentation, we would want to administer pre-intervention surveys to serve as a baseline, basically understanding where is the overall health and the status of interprofessional collaboration already existing within our healthcare system. Moving forward, every 3 months, we would then offer on a quarterly system qualitative surveys that would be administered within the interprofessional team to evaluate progress along several key parameters. There are already pre-existing survey tools such as the Interprofessional Collaborative Practice Survey, which has been recognized by the World Health Organization, which we would look towards as a great template for building a survey that is efficacious in evaluating interprofessional development. We would then also tailor it that specifically to our interventions as well. The key parameters that we'd like to assess would be the work culture, environmental mechanisms, and institutional support systems. Within these key parameters, we'd be asking specific questions to gather insight regarding if our key intervention of interprofessional and interdisciplinary meetings would be increasing interprofessional communication, promoting a culture that implements change quickly, and fostering a culture of trust, as well as promoting equality in decision-making and the ability to voice concerns regarding patient and staff safety. With the assessment of environmental mechanisms, assessing if there's input is received about potential modifications to workrooms and facility safety for healthcare providers and staff. And lastly, our assessment of institutional support mechanisms would include assessment of senior leadership and interprofessional collaboration among not only just team leaders, but also within healthcare providers that they oversee, as well as then lastly looking at resources for employees facing burnout, which directly correlates with our second intervention regarding complementary therapy and even the projects such as town halls regarding COVID burnout. We would then take these qualitative responses and then which basically range from strongly disagree, disagree, agree, and strongly disagree, tabulate that into quantitative data with assigning them numerical values, and use multivariate analysis to then gather statistical trends on a quarterly basis. So we could determine between Q1, which is 3 months out, versus Q2, 6 months out, whether we've seen improvement along these key metrics. We would hope this longitudinal data would then guide interprofessional committee meetings to then make necessary changes and then also understand the areas in which our interventions have been successful.
I'm going to be talking about how radical belongingness is sustainable and scalable. So we plan to make sure that these interventions are sustainable by using the assessments that we've just talked about. Analyzing these assessments will allow us to gather information about the interventions that we've created. And the information gathered is going to allow us to make any adjustments to the interventions if needed. This is especially important because things change over time, and these assessments will allow us to see what kind of things are working and what kind of things are not working over time. So how is this scalable? Sharing assessment data would allow for other healthcare facilities and organizations to compare what type of things work. This would also allow them to share ideas and to see how other organizations are doing compared to their own. These monthly meetings between healthcare facilities and organizations would also allow for more collaboration. This is also important because certain facilities and organizations may be impacted by if they are rural or urban. Are they small or large organizations? Are they private or public? And are they located in affluent or impoverished areas? I think that these factors really impact these organizations and will impact the interventions that work for them. And being able to attend these monthly meetings will allow them to collaborate and see what type of things work and what type of things are not working for their facilities. And this concludes our presentation. Thank you for listening.
Now that we've kind of gone over our entire project, I wanted to touch on some of the lessons about teamwork and radical belonging that we have learned from doing this project. So the first thing about teamwork that we really wanted to emphasize is that it's very important to utilize strengths of all team members in the group. And that's especially true because we're potentially coming from, I think, 7 different healthcare fields. So we all naturally have different backgrounds on things that we're more comfortable with, and our strengths are different than a different person on our team. So it's important that we play to everyone's strengths and really make sure that we're getting the best out of everyone that we can, because that will overall lead to a more efficient and productive team and increase the quality of care for a patient. Additionally, we wanted to touch on that communication is key to success for any group. And that's especially true with this project because this has been something that's been entirely online with people we probably have never met before. And for that reason, it's really important that everyone in a group is willing and open to discuss different ideas with all members of the team and to be very responsive whenever anyone is trying to communicate with the group. Additionally, we learned that defining clear roles helps identify expectations. And again, with this being an all online project, this was first and foremost one of the things that we wanted to make sure that we did, because it helps to keep everyone accountable and just on the same page in terms of what needs to be done. And then finally, for our last lesson on teamwork, it was personal accountability and responsibility are essential, because if you say that you're going to take something on, everyone else in the group is expecting that, and we need to be respectful of our other members in the group and just really do what we say we're going to do. Now, in terms of what we learned about the project and radical belonging, one of the biggest things I think was very beneficial about this project is that we got to really dive into what radical belonging really means, because I know personally I had never heard this exact term before, so it was good to just kind of explore that and see what really makes up radical belonging. Additionally, it was nice to be able to see how radical belonging has been affected by COVID-19, and it kind of opened our eyes to a lot of different disparities that not everyone may have known before. And then we also wanted to touch on how belonging and feeling like you belong really can affect the quality of care and much more than that, just below the surface. So if some people don't feel like they belong or are truly part of the team, it's going to decrease the efficiency and effectiveness of your team and lead to decreases in quality of care, communication, comfort, and much more. So it's really important that we address this from the root to be able to make sure that everyone feels like they are a valued member of the healthcare team. And finally, I know that throughout this presentation, we've talked about some of the obstacles and issues facing achieving radical belonging. But there are multiple ways to address these issues as well as assess them, and there's not one clear-cut answer that's going to solve all of the issues that we've talked about. However, there are steps that we can take as long as we're intentional in our actions and put forth the effort to really work towards improving feelings of belonging on interprofessional teams. We can make valuable strides in this area.